working our way down to the muscles of the chest, back, and a little bit of the shoulder with the rotator cuff. If you look at the first picture with muscles of the chest, I would like to point out that there are two muscles going from behind his ear down to his collarbones that you can see. Those are your sternocleidomastoid muscles. They're not labeled on here, but they come down at an angle, and you can see where they would come from the mastoid process to this internal place where your sternum and clavicles meet, right here. So you can see those on the picture. Working our way down, I think some of those muscles are pretty familiar, at least the shorter versions of the name. Your traps, your delts, your pecs. The pectoralis group is the first one listed that we need to talk about, lateral chest. We learned this is your pectoral region right off the bat. The pectoralis major is shown in the picture, but your pectoralis minor is underneath. It's going to be a muscle that's associated with breathing. Actually, it helps move your ribs when you breathe in, which is pretty cool. For the rest of this, let me scroll down. What we're going to be doing is similar to the muscles of the face, neck, etc. I'll give you the location and the function. If you think about your pecs, if you've lifted, the pec deck goes this way. I believe I also mentioned with muscle fiber is that it's chicken pectoralis. That's your chicken breast. If I flap like a chicken, this action of pulling my arms in front of my chest is the major action of the pectoralis. There are little actions too, like little rotations for a lot of these muscles, but your primary action of this is to pull your arms across. Serratus anterior. If I tell you to go in the kitchen drawer and get me a serrated knife, I'm looking for one with a sharp, jagged edge. And the serratus anterior has that jagged edge as it attaches to your ribs down the side, jaggedy. Don't worry if we've skipped muscles in this picture that you want to talk about. The big ones we're coming back to later also. The serratus anterior is pretty cool. And if you look at like skinny dude build, like muscly skinny dude, you can see it right here. As usually 3 or 4 little lines that come down along ribs. The action of your serratus anterior is to pull your ribs up. Why would you want that to happen? Big deep breath to increase your rib cage volume and let your lungs fill to a greater extent. That's pretty cool. Those are really the only chest muscles we'll look at. For your back, and some of these were visible, the traps were visible in that picture too. The traps are right here. They're the ones if you do too many shrugs, they eat your neck. The traps, if you think of pulling on a trapeze, they're right here. They go from the occipital, the back of your head, to your scapula and thoracic vertebrae. They make a kite shape in your upper back, and there are 2 halves, left and right. And the traps, shrug your shoulders. They're one of these kind of motions. We talked about elevation of your shoulders in the joint motions section, and your traps do that. Latissimus dorsi has a really cool name, not just because it's long and fancy in Latin. It says where the muscles are. Latissimus, the mus part means most. That says most lateral. And dorsi means of the back. They are the most lateral muscles of the back. And they are. Your lats are here. They're pretty crazy because they start with some connective tissue down here. This is all connective tissue that goes with them. They are here. If you've ever done lat pull downs though, even though they're in your back, they attach in your armpit. They attach to your humerus under your armpit. So if I wanted to work my lats, I'd be doing pull downs, even though they're a muscle of the lateral back. They pull your arms down because of the attachment, the insertion on my humerus. Rhomboids. I hate my rhomboids. Your rhomboids go from your top thoracic vertebrae over to your scapula. They're rhomboid. We talked about OID, meaning shaped like a rhombus. Rhombus, like crooked rectangle, math class rhombus. They go from the thoracic vertebrae to the scapula, and they pull your shoulders back. Like if someone pokes you between the shoulders and you kind of do that chicken wing thing, that's what your rhomboids do. For some reason, I get knots in them. A lot of people do. The trainer has that ball thing on a stick, if you've ever seen it, to work the knots out between your shoulders and your backbone. A lot of times those knots are in your rhomboids or in your traps from stress, from sitting, from overuse. And they're really tough to get to yourself because the harder you try when they're sore, the less your arm wants to go back there. So rhomboid spasms or rhomboid knots are really uncomfortable because your arms are kind of stuck backward. And they're pretty painful. Levator scapulae. I always say if you take the E off the end and put it at the beginning, it tells you what they do. Elevator scapula. They go from the cervical vertebrae here in your neck to your scapula, and they sort of help. Like your traps are more of a full shoulder motion, but this is like an up and back of your scapula thing with your levator scapulae. Back spasms are a pretty terrible thing also. I was talking about the rhomboid, but you also have these erector spinae muscles that run both sides of your backbone. They're long, thin columns of muscle that go just about top to bottom. And a lot of times, if you hear people saying they have back spasms, a lot of times the erectors are part of the problem because they would straighten you up. And if they're tight, you're kind of like over tight. I had a kid that ran for me years ago say to me once, "My back really hurts. Can you see anything?" I'm like, "I don't know anything about your back." And all of a sudden, I'm looking at this skinny kid back, and there is a muscle that I can see standing out of his skinniness, and I'm like, "I think you need to see the trainer." Because I could see the perfect outline of the muscle because the spasm was so bad. Same thing as the kid who shows me his calf and goes, "It hurts and I don't know why." And there's like a golf ball sticking out of the side of it from a muscle spasm, and I go, "I think you need to see the trainer." That's usually, like, if they're bleeding, we're good. But when they get those knots in them, put the TENS unit on those kids and fix them up. I'm not doing that. With the erector spinae, though, it does extend your vertebral column. This one's kind of cool. If any of you follow baseball or do throwing sports or whatnot, one of the big injuries right now is Tommy John surgery, and that's a lower forearm injury, an ulnar collateral ligament. Rotator cuff injuries are also problematic for people who throw forcefully. When I was little, I thought the rotator cuff was like a blood pressure cuff, which coincidentally I have a blood pressure machine because I'm at home. I thought it was a cuff like this that went around your arm on the inside here at my shoulder, and I couldn't figure out where it was, like why I couldn't see it. I thought it was one of those things like the cervical collars, like the human cone of shame, but it's not. Your rotator cuff is basically sheets of muscle on the front and back of your scapula that slide along the scapula out to the shoulder and stabilize the glenohumeral or shoulder ball and socket joint. You've got two parts of it, and I'm not going to ask a lot of questions about the rotator cuff. In general, it supports the shoulder because we talked about the socket being shallow. So that shallow socket doesn't like to stay in place. If you look, the first view, the anterior view, is looking through someone's chest. And you have the subscapularis muscle that translates under the scapula. It is between your scapula and your ribs. It is under your scapula, and it attaches to the humerus in the front. On the back, you have three more muscles: supraspinatus, which means over the spine; infraspinatus, which means below the spine; and teres minor, which I don't remember what that means. It's nothing as exciting as supra and infra. Prefixes I know. You would see supraspinatus, infraspinatus, and teres minor from the back. So you have four components to this rotator cuff. So if you have the piece coming in the front and the piece coming in the back, it does a pretty nice job of keeping that shoulder joint stabilized and in place. And that's why rotator cuff injuries are so bad, because it can then slide around. So as far as muscles of the chest and back go, we're done. We're going to lead into arms. We will come back and get deltoid and bicep and triceps and all of those. But first I wanted to go through all of this. And the rotator cuff was sort of in between, so I put it here. On to the next. It's so sad. I love this section talking about muscle anatomy. We're almost halfway done. Have a good one.